Hey there, Jennifer Bell here, and I wanted to talk to you today about the difference between a Medicare supplement and a Medicare Advantage plan. So what I'm going to do is I'm going to start with Medicare supplements. The way a Medicare supplement works is it works second to Medicare. What I mean by that is Medicare is the primary payer. So Medicare is going to pay first, the supplement is going to come in and pay second. Anywhere Medicare is accepted, the supplement will follow. So if your doctor takes original Medicare, then they would also take your Medicare supplement. Now, the Medicare supplement also has a monthly premium that you need to be aware of. And so depending on the state you live in, depending on your age, depending on the plan, there's a monthly premium. And over the course of time, that premium does increase. And generally speaking, it's on an annual basis. It kind of just depends on the company that you have. Most of the carriers that I like to work with will lock in your rate for 12 months and just give you an annual increase, which is pretty good. Most of the time, those increases can be somewhere between 5 and 8%. Some other companies might be 12 to 15%. We try to stay away from those. But yeah, we're trying to work with companies that are going to give you good coverage and at good rates. So that's how Medicare supplements function. Now, Medicare supplement is only going to pay second to Medicare. And what I mean by that is they only pay what Medicare pays for. So if you have a Medicare supplement in place, then you also need to add on a prescription drug plan in order to have comprehensive full round coverage. So keep that in mind when you're looking at Medicare supplements. Now, they also allow you to go all over the country and even in our U.S. properties. So anywhere that Medicare is accepted, you can take your Medicare plus your Medicare supplement. The thing I usually relate to folks about that is if you get some sort of an illness and you want to see the best doctor in the nation, if that doctor and the hospital they work out of takes Medicare, then you can go there with your Medicare plus Medicare supplement. So just keep that in mind. Now, on the flip side, a Medicare Advantage plan is going to work differently. Medicare Advantage actually takes over from Medicare. So what I mean by that is no matter what kind of insurance you pick, you have to pay for Medicare. So you've got Part A that's usually premium free because you'll pay into Medicare as you work, and as long as you work your qualifying credits, then Part A doesn't cost anything. Part B is where you have to pay your monthly premium. No matter what insurance type you get, you have to pay Medicare Part B premium, right? So that Part B premium gets redirected from Medicare to the insurance company. And so that's how a lot of these Medicare Advantage plans get paid, is they're getting paid kind of on the back side. And then they're able to offer you a zero premium plan option. And so a lot of folks will say, I've got free coverage. But the thing is they're still paying for Medicare through deductions from their Social Security income. So that's just how it works unless there's Medicaid involved. And then of course Medicaid might be paying for that Medicare Part B premium. So on the Medicare Advantage plans, this is more of a pay-as-you-go structure. So you might have a no premium plan, or you might have a lower premium plan, or even a higher premium plan. But what that means is if you have a Medicare Advantage plan, every time you see a doctor, have a procedure, get admitted to the hospital, get an ambulance ride, have physical therapy, all of these things, generally speaking, you're going to pay a copay or co-insurance. So it's a pay-as-you-go. If you're super healthy and you never go to the doctor except for maybe an annual physical, you don't take any medications, this is awesome, right? Because you're not paying as much in coverage for Medicare Advantage plan, and you only pay for when you need services. So that's kind of one way to look at it. Another thing with Medicare Advantage plans is a lot of them will beef up their coverage with added benefits. So they'll give you dental, vision, hearing, over-the-counter credits to use to get supplies on a quarterly basis at no cost to you. Some plans even offer free transportation to medical appointments or fitness programs where you have like a free gym membership. So these are some things to think about when you're thinking about the different kind of insurances that you want. The Medicare Advantage plans also are going to work in a network type of a situation, I guess you could say. They have HMO plans where you can only see providers who take the insurance. And if you go out of the network, you'll have to pay cash for that. And then they have PPO plans where you're going to get better rates seeing a preferred provider or someone who's in network versus someone who takes the plan but on an out-of-network basis. So when you are checking to see if doctors take the plan, you always want to ask if they're in network, not do you take the plan. I always like to throw that out there. But basically with the Medicare Advantage plans, you're going to be on like a geographic basis. So I'm here in Colorado, it'd be like the Denver metro area. That might be a geographic basis. A lot of the plans though with the PPOs do have national networks. But again, they're still the pay-as-you-go plan. So if you're on a PPO plan with a national network, you're going to be able to go all over the country as long as the doctors are taking that PPO plan or in network. You get the better rates. So Medicare Advantage plans versus Medicare supplements, there's quite a bit of differences, I think, between the two. You definitely want to look at the type of medical coverage you want and then go from there. Then start looking at benefits. But really look at that type of medical coverage that you want and make sure that you're comfortable with your financial responsibility, whether that be the financial responsibility of paying the monthly premium or the financial responsibility of paying those co-pays and co-insurances as you need services. I hope that helps. I was trying to make it kind of a quicker comparison, so you might still have some questions about your specific situation, and I am happy to answer your specific questions, so please reach out to me. You can email me or call me, and I'm happy to work with you one-on-one just to kind of get you through this transition. It's pretty fun. And then also, if you wouldn't mind subscribing to my channel, then what we'll do is get you some updates anytime we have updates with Medicare. And you are welcome to share this with your friends as well. There's lots of people out there who are thoroughly confused by Medicare and all of the things that it does, and I'm happy to be of service to all of you. So I hope you have a wonderful day, and I will see you in the next video.